Hi everyone, welcome to my presentation on learning about occupational therapy. My name is Vange and I am a graduate student at St. Catherine University in Minnesota. The purpose of this presentation is to give you an overview of what occupational therapy is, and for those who are a high school students, this presentation might interest you in thinking about what to study in college. So, if you're considering in going to college and you are not sure what degree you want to pursue, or you're still looking, maybe occupational therapy is right for you. There are two parts that I want to go over. First is looking at the overview of occupational therapy, and the second part is diving into universities that offer occupational therapy programs. So, the main objectives for this presentation is to get you familiar with occupational therapy, get familiar about the rules of OT in different settings, learn about universities that offer OT program, answer questions you might have about OT, and get feedback from you. So there is a feedback form at the end of this presentation, and I really want to hear from you and what you think of this presentations and overall about OT. So, what is occupational therapy or OT? OT is a profession helping people in all ages to recover from injuries or illnesses or maintain functions in order to participate in daily activities that they love, want, and need to do every day. So, occupational therapists are healthcare professionals who help people resume or maintain engagement in many tasks despite limitations in physical or mental functioning. OT is the only profession that helps people across the lifespan to do the things they want and need to do through therapeutic use of daily activities. So, looking at this slide, broke it down into definitions to really help you understand what occupational therapy means. So, first is the word occupation. That means activities that we engage every day. So, I listed a broad category of occupations, and the first one is the self care or activities of daily living, and activities that includes under that category is the bathing, showering, eating, brushing your teeth, or putting on your clothes. So anything that you do for yourself. We also have instrumental activities of daily living. That means that includes cooking, cleaning, shopping, grocery shopping. And we also have sleep and rest, education, work, play, leisure activities, social participation, and health management. And the word therapy means treatment of a physical or mentally ill. Any services that you provide to the patient. I know these definitions or terms are really broad, but it really helps you see an overview of what occupational therapy is. There's so much to learn about occupational therapy. Who needs OT services? So in this slide, it's all ages who have health problems that interfere everyday activities. So patients who have stroke, brain injury, joint replacement, spinal cord injury, cancer, mental health, cerebral palsy for children, trauma, birth defects, ADHD, autism. So it could be anything. What does an occupational therapist do? So this is just an example of an occupational therapy, like working with children and teachers in the classroom to help develop skills such as handwriting, emotion regulation, adapt routines in the classroom. So most of the time, children with disability have a hard time developing routines in the classroom. So an OT rule would help these children engage in the classroom activities. Also working with mental illness population, and working with patients admitted to the hospitals. These are just a few examples of what occupational therapy do every day. Occupational therapists work in a wide range of settings. So settings include when working with older adult or adult population. We have acute care, acute inpatient rehab, subacute rehab or skilled nursing facilities, home health, outpatient hand therapy, neuro, mental health, workplace ergonomics, and academic and research settings. So when working with children or pediatric OT settings, we have school system, early intervention, outpatient pediatrics, and hospital-based pediatrics. So you see occupational therapist works in a wide range of settings. So I'm really excited to let you know that there are schools in the Philippines offering occupational therapy program or courses. So I found that the De La Salle Medical and Health Sciences Institutes offering Bachelors of Science in Occupational Therapy, as well as University of the Philippines Manila or UP. They they offer bachelors in occupational therapy and masters of occupational therapy. Cebu Doctors University is also well-known universities in the Philippines, and they offer BS in OT and as well as Master of Arts in Occupational Therapy. These are the top three that I thought it is good for OT program. And I found more schools or universities that offer occupational therapy courses. So we have the City College, Emilio Aguinaldo College, Davao Doctors College, Angeles University Foundation, and you can see the names in the slide. I want to point out the Southwestern University is a really good one in Cebu, and we also have the St. Paul University, Philippines, and the University of Perpetual Health System. There are a couple places that they offer in Las Piñas, Manila, and Cavite, and Laguna. In order to get admitted or accepted into the program, there are some basic requirements and qualifications before you apply to the program. So again, the bachelor's degree in OT is a 5-year degree program, and you must be a high school graduate. If not, there's an alternative. Student can take alternative learning system and pass the Philippines Education Placement Test if you are not a high school graduate. And student must pass the college admissions test of the university. So some basic requirements: you need to have a form 1 through 8 or a high school report card, letter of recommendations from your professors or teachers in high school, medical and dental records, your NSO, certified birth certificate, your certificate of good moral character, your copy of honorable dismissal, copy of a high school diploma, and a 2x2 ID picture. So these are just the general subjects and curriculums that are taught under the program in the Philippines. So we have anatomy and physiology, gross and organ system anatomy, ethics in OT, introduction to OT and rehabilitation, theoretical foundations in OT, evaluation for physical dysfunction, introduction to clinics, human behavior in OT, therapeutic skills in human development, and orthotics and prosthetics. So these are just a generals to give you an idea of what the curriculum is all about. Going to college is another stepping stone in your life, and it can be very, very fun. General advice for going to college is do well in high school, do volunteer hours in the community. You can shadow or observe someone, an occupational therapist, if that's available in your area. Going to college is another stepping stone, another journey in your life, and it can be very fun. So a general advice for going to college is do well in high school, get that high GPA, and do volunteer hours in the community. You could shadow or observe an occupational therapist if that's available in your area, And I added a link, the Philippines Academy of Occupational Therapy. It's a really good resource. You can see how many, there's a statistics of how many occupational therapists are there in the Philippines. And I highly recommend to check that website or survey. And that's all I have. Thank you for listening to my presentation. And please don't forget to share this presentation. And I have the feedback forms, and I'm looking forward to hear from you. Thank you.